Yes, please go ahead.
Okay. Good evening, all. Just like you have said, I'd like to thank everyone for giving me this opportunity to just share my experience as to this important discussion, especially on the COVID-19 pandemic in Nigeria, a panacea to national development. A professor has actually, Chidi has actually talked a lot on this. And I think I will be sharing and tailoring my discussion more on the health aspect. So I would like to also share my screen so that I share my screen and then the discussion on the presentation so I can quickly look at it. Okay, let me just talk briefly. Okay, I did an outline of the presentation, and because of time, I may not go into all the introduction and maybe the facts about the coronavirus, those ones we know, and which we have already talked about. Coronavirus, like we know, is a public health emergency, and it has actually become a crisis, especially in Nigeria. Almost every sector is affected. The global picture is there, the African picture is also there, and the Nigerian picture is also here. As of today, we are still having like 35,000 confirmed cases, which is actually like a tip in the iceberg. Because as of today, I can really tell you that just about 200 test samples that were conducted in Nigeria in a population of about 200 million. So we can actually see that we have not gone anywhere, and we are really heading in for a serious issue, crisis, because by the time we increase the number of our tests, we'll just know that the confirmed cases will actually be too much. And right now that even some of the states that has no testing centers or testing centers, you can actually agree with it, but we're just talking about a very low figure as at now. So that is another serious challenge, which NCDC, and the leadership will actually have to talk about. Because if we cannot test more, we cannot, because even most of the symptoms we're having, people confirmed cases are still asymptomatic. And that is to say that so many people that we're walking about with are also infected, but we're not aware. So we need to actually increase our testing abilities and capacities all over the country. And to also say that some of the states that we're still battling with them, talk of Cross River states and Kogi State, who actually gave us a lot of issues before they even have to succumb to testing some of their citizens. And we're just scratching the surface. So we're actually in for a lot of issues. So asymptomatic cases is a serious issue that we need to talk about. And up to now, NCDC, we have about between 65 to 70% of people who are confirmed cases are still asymptomatic. So is a serious issue, and complications and all that. So the incubation period as part of that, which we know very well, will also help us to know about the spread and the transmission, and how to also talk about self-isolation and then the quarantine. Right now, the transmission is still person to person, droplet infection, and also airborne. Recently, about a week ago, WHO has to come again and say that there is an element of airborne transmission. And that is another serious issue, which we now know that the thing is still going to go far. Before now, we're talking about just respiratory droplets, and that means it can actually stay just for a few, within 1 meter or 2 meter distance, we can get it. But now that it's airborne, some airborne transmission have been implicated, it means that we still need to be very, very careful about this pandemic. And nobody knows how far we are going to go. By airborne, we mean that we have small particles of this disease that will be traveling over long distances and for a very long distances to affect so many people and staying longer in the air. And so we are actually in for a serious time with this COVID-19. Okay, so, and the Nigerian healthcare system, just to talk about it, just like we know the 3 tiers of the government, the federal, the state, and then the local government. The federal is actually taking care of all the policy guidance, the planning, and the state takes care of the general hospitals and all that, and then the primary healthcare system. If you look at what is actually happening at our primary health, the Nigerian healthcare system actually is a serious issue, because right from the federal to the state and all that, there is a serious issue. When you come to our health situation, even before, prior to COVID-19 pandemic, if you go to the primary healthcare system, we have over 30,000 primary healthcare centers in the country. But right now, just about 4,000 facilities are even functional, you know, and the functionality we're even talking about is more of the infrastructure that are there. But when you talk of resources, when you talk of services, when you talk of human resources, they are not even there at all in the primary healthcare centers. As of now, the first two levels, the primary healthcare and the secondary healthcare, have actually collapsed. And then we're actually talking about the 3rd tier, which is the tertiary system. There is an overload and abuse of facilities, the fatigue of the healthcare staff there, because even there is a lot of high patient health ratio, especially in the tertiary institution. So the efficiency of the professionals is not there. There is emotional drain, and then most of the time we'll start having a poor outcome, rude outcome with patients, because the staff and the professionals are actually overwhelmed. Even diseases that should have been arrested at the first care level sometimes will now metamorphose into an epidemic, and that is exactly what we're having. And so there is poor governance and leadership, just like our professor have talked about. Even the leadership, the primary healthcare under one roof and all that, the whole thing has collapsed. There is inadequate and poor capacity of human resources. There is poor infrastructure and equipment. Investment in infrastructure is actually very poor. Modern health facilities are not there. Commodities and supply chain, which we need to supply just from the federal down to the grassroots, is not there. There's poor funding. Up till now, the annual budget of the government for health is still about 4.7% of the national budget, which is equivalent to like $5 per person per year. And we're not able to meet up with the Abuja Declaration of 2005, which represents about 15% of funding from the government. So this is actually a serious issue. Remuneration of healthcare workers is still meager, and we know that it's actually creating a massive brain drain for our health workers, even to Europe and US. And there's rarely any top medical institution in the US or Europe where you don't find Nigerians managing at the top level. Somebody has once said that if we can withdraw our services from the health sector in the US, it means that even their health sector will collapse. That's to say that Nigerians, we don't have problem of the healthcare workers, but the remuneration and how to take care of our healthcare workers is actually very key. And that is what is happening with our strikes and the doctors and the nurses, because of poor salaries, lack of government investment in healthcare sector is actually key. Poor implementation of the National Health Insurance Scheme up till now is still a big challenge. And so we can't have universal healthcare coverage. Then we are still dependent on donor countries, multilateral organizations. Up till now, Nigeria is depending on so much of donors. So corruption in the health sector is another serious issue. So these are issues that we need to actually tackle. In the health sector, corruption is like the 3rd most corrupted branch in our country. And corruption is actually key in this country. So the health situation, which we have before the COVID, lack of proper hygiene, infection control measures, poor socioeconomic status and culture, poor education and illiteracy, poor housing, having a huge negative impact on health. Insecurities are even there in the midst of this COVID. The Boko Haram, the herdsmen attack, kidnapping, which is also affecting our health. There is high rate of unemployment. Other crimes, rape, armed robbery, and bunkering are also there, which is staring in our eyes. So the COVID-19 has actually come to now act as a deadly ripple effect on our health of the people, especially in Nigeria. So it's threatening all the gains we have since the millennium and the progress we have made. So it's actually a serious issue. There's also an evidence that there are so disruptions in health services, preventable deaths are even increasing. Malaria, HIV, and tuberculosis are also increasing. Even now, it is very difficult for somebody to go to health facilities to be treated for malaria, because of fear of COVID. And due to even COVID-19, vaccination campaigns for our preventable diseases, polio, measles, cholera, and meningitis, all have been postponed. Recently, UNICEF have even said that about 117 million of our people in the countries are at risk of missing out on the life-saving measles vaccine and other preventable diseases. So the COVID has actually come to worsen the situation because we're not actually prepared. The country was not prepared. There's no investment in health sector. It affects both the rich and the poor countries alike, but we can now see that the worst hit are even those that are the poor countries, or those that are poor, especially the less privileged and all that. So recovery rate is collateral damage, primary healthcare issues are all that are also staring at our face. Recent evidence have also shown that about 30% cannot even access emergency healthcare now. When you want to access emergency healthcare within 2 hours of travel is actually very difficult. There is dearth of aggregated, disaggregated data for decision making. Prof has actually talked about that. There is weak monitoring and evaluation system now. The demand for healthcare sector has even affected us. There is massive, due to massive overwhelming on healthcare facilities, income, social status, tradition, quality of health services, all have actually decreased. Even the health-seeking behavior of our individuals or people have even been affected. People are no longer going to hospitals to seek medical attention. Many people are even afraid for even going for tests and even labeling them a COVID-19 patient. Then there is loss of health manpower as a result of death of so many of our health workers that are getting infected. Productivity loss is actually a key issue. Many of the workers and others are infected, and then we don't have time to even do all of that works. So many are even in the isolation centers. There is high attrition rate of our health personnel moving out of this country. I think recently we heard about almost about 58 doctors were going out of this country. Even without visa, they are ready to give them employment without even getting visa. They are taking them away from Nigeria. That is the effect of what is happening. There is an overwhelmed infrastructure and medical facilities, standard treatment centers in some states, as we're talking about now. They don't even have treatment centers. There's no isolation. There is no holding centers for so many states. And so where are we heading to? There's increased patronage now in private individuals. The people consult pharmacy shops or patent vendors, and then self-medication is on the high increase because you cannot get even to the health workers or to the health facilities for any attention now. Health systems are actually overwhelmed, leading to increased death caused by lapses in routine care of the pandemic. Health disparities, health inequities that are created, social determinants of health like food supply, housing, economic, relationship, transportation, and education. All these are effects that we're actually having as a result of the COVID-19. So what lessons do we learn from this COVID-19, which is what we are actually very much interested in? And we need our policy makers, because I think this COVID-19 should be actually a wake-up call to our policy makers and all our citizens not to rely on foreign healthcare services. And it even makes it very much difficult for us for international support because of the competing demand for medical supplies and equipment. So it's actually a wake-up call for all of us, our policymakers, to actually wake up to our responsibilities. As countries grapple with this COVID-19, we need to also strengthen our primary health care to provide a line of defense and response to keep people safe and healthy. You agree with me that if we can strengthen our primary health care at that level, so much of the outbreaks can even be tackled there. But as we are speaking right now, the workers at the primary health care are not even trained. Most of them don't even know about the COVID. Even the personal protective equipment are not even given them. So in the midst of the emergency, the world cannot afford to ignore the broader health needs of people, especially our vaccination, which takes place at the primary health care, reproductive, maternal and child health care. Even the issues of HIV, TB, and malaria are also affecting people, complicating the COVID-19. Mental health, all these treatments is causing a deadly ripple effect on our society and leaving millions more vulnerable to illness and death. These are the issues we're talking about. So we must emerge, for us to move forward, we must emerge from this pandemic stronger. And countries and donors must put investment in primary health care as the cornerstone, which is the foundation of our health and well-being for everybody. And then it should play a crucial role, especially for the low and middle income countries, especially which Nigeria belongs. So what is the way forward after discussing all that? You know, so I used to say that there's a joke that somebody said that if you give monkey banana, put banana in one side and then put a pack of dollars on one side and tell the monkey to choose one, the monkey will actually go for the banana because that is what he likes and that is what he knows as something to eat, not knowing that $1 out of those packs of dollars can buy a lot of banana for him. What are we saying? That our people, if you put health and wealth together, people will just go and take wealth because they think that wealth is more than health. So we need to actually let our people know that health is wealth, because health is very key. And people are still very ignorant about health. And a more integrated response is actually required if we need to address these structural issues that make this country less resilient to shock and limit the range of policy responses. So we actually need to address that in a more integrated manner. And then we need to fully unlock the potentials of the primary healthcare if we want to respond to this virus. Equip our workers with up-to-date information, personal protective equipment, and keep them safe, supplies to screen and then test patients early. The government must also invest heavily in the workforce, which is very, very key. And the positioning of our health tertiary institutions, its workers, better equipment, remuneration to handle emergency infections and complications are also key. There's the need for trained and mobilized network of community health workers so we can track and then treat the disease, especially in remote and rural areas. By the time we are getting to this community transmission, we actually know that we need our community health workers to be able to track and also treat the disease in remote and rural areas. When the number of infected people gets so much, we may not be able to keep them in all the treatment centers. And so we need to empower our community health workers, and especially at the primary health care, so we can be able to track them and treat this disease. So we need increased public-private partnership, community ownership of government health interventions, sustained advocacy to community gatekeepers on key interventions, and then capacity building of our skill providers, including the doctors and the nurses and all the community health care workers. Improve quality of healthcare, and then infection prevention practices. Private sector engagement is also key so that they can also be involved in what we're talking about. Innovation and technology to promote data use for action. Other health parastatals under the health ministry will need to actually collaborate extensively with NCDC to make sure we can tackle this pandemic. The investment in risk communication for massive sensitization and awareness as a result of the unavoidable community transmission. Right now, many of our communities, they still do not even believe that COVID-19 is existing. And I think that our risk communication is actually poor in this area because so many people, we don't have at the community announcers and communications for these people to know. At the level of the community, if you go there, nobody's keeping any social distancing. People are not even wearing face masks. All the safety procedures are neglected. And we need to do a lot of this effort in this area to make sure the awareness also increase. If not, by the time in no distant time, when it hits so well in the community, it will actually be a disaster. So what are we saying? In conclusion, COVID-19 is actually supposed to be a remedy or a solution to this, our better, weak, and damaged health system in a stronger way. This should be like a time of sober reflection, which will give us the latitude for us to correct our mistakes of the past, especially on the issue of corruption, poor leadership, greed, and selfishness, lack of investment in health, manpower, and infrastructure, all the poor funding and dependence on oil and donors and medical tourism. We need to learn from this so that we can correct these mistakes. Now, even if you want to go out of the country for treatment, you cannot go because of the pandemic. This should be a reflection for us to put our health system right and make sure all the things we need, especially on our healthcare workers and the equipments, and putting our infrastructure right on the issue of healthcare workers is key. In the long term, tougher decisions need to be made, including diversifying our country revenue away from the oil and then improving investment in healthcare sector. And COVID-19 pandemic has actually given us the remedy to the basics of healthy living. Before now, many people don't know about all the basics of our prevention, infection prevention control, which is hygienic practices. It's taking us back to the basics, and which all of us need to actually practice. Our hand washing, our respiratory etiquette, social distancing, and all, which is very, very key. And we need to actually learn this. Everybody needs to keep to this so that we can actually bring down the tide for this COVID-19. So we need to take personal responsibility, collective responsibility. Enforcement is needed. Leadership is very key. And thank God the professor was talking about the presidential task force. A lot still needs to be done. If this is not done, in the next, in no distance time from now, we'll be heading in for a serious disaster. Because what we're actually seeing now is still a tip on the iceberg, and we don't know how far we are going to go. It might actually take us 1 or more years to go because the thing is actually still increasing. We are not at the peak yet from all the things we're seeing, because even the tests we're talking about, we have not gone halfway. So we need this to be able to bring this to reduction. Thank you very much for your listening, for taking your time and discussing all this. Thank you.
Thank you very much, Dr. Daniel Otoh. Really, really appreciate your comment, your lecture rather. Why I'm stuttering right now is because I have seen so many issues that we need to address. The issue of corruption in the healthcare sector is what I'm worried about, because if we can have corruption in the healthcare sector, that means people who cannot afford high quality healthcare, who cannot afford to travel outside the country to address their health concerns, will just die off because we do not have adequate medical supplies, especially at the primary healthcare sector, which you mentioned. The training is very important. Also the issue, I don't know if you would also probably during the question and answer, you address the issue of abuse of herbal medication when it comes to the treatment of COVID-19. Some persons have resorted to drinking some concoctions, which in the end would have an adverse effect on their health, and the discrimination of COVID-19 patients. I'm sure by the time we come to the question and answer section, you'll be able to clarify that. Please remember, you need to write down your questions in the comment section or the chat box. when it's time, address whoever you're addressing. Please note whoever you're addressing your questions to, so that I would read them out and enable our guest speakers to address them. So let's quickly go to the next guest speaker for the day. He is Dr. Emeka Fleming Okengwu. He's the Chief Executive Officer of the Agro and Allied Green Technologies Resources Center Limited, an agro-based project development and management company based in Abuja, the Federal Capital Territory. Dr. Okengwu has a BSc, MIE, and PhD in Political Science, Entrepreneurship Studies, and Development Economies from the Universities of Nigeria, State University in New York, ICCL, Doctoral Research Center, Nigeria, and the United States of America, respectively. Now, his career in public service sector was in the services of the University of Nigeria in Nsukka and the World Bank funded National Primary Education Commission, where he worked as an administrative officer and special project officer. Now, he is a member of the Strategic Committee for the Development of the National Agricultural Transformation Plan for the Federal Ministry of Agriculture and Rural Development. And we are so grateful to have him be a part of this webinar today. Thank you so much, Dr. Okengwu, and the floor is yours. Please go ahead.
Thank you very much, Georgina. You're very kind with your intro. Good afternoon, everybody in the chat room. I've listened to everybody's, I've seen the comments that people have also made in response to Chidi's comments and that of Doctor. There are two ways you want to look at this problem. You either want to look at it from the problems of development failure, or you want to look at it from the problems of total and complete ignorance by those who have been trusted, with the governance structures of the country. In looking at it as probably the failures of our governance structures, I think that's the trajectory I want to begin with. And in doing that, I like for us to look at, because my role here is to say, what can we benefit? How can we be able to use this to be able to develop, or to be able to engage more in having a country that is more socially inclusive? We've always had one very major problem in Nigeria, and that major problem we've had, and every administration that has come has talked about inclusive growth. And each time we talk about inclusive growth, nobody's ever bothered to say, okay, can we be able to actually give a definition to growth, a definition to inclusiveness? What are we talking about? And let's take it back to development and look at development from three broad sectors or three broad trenches. The first trench of development is what you call your human capital development. And this is where your education policies, your education systems, must come to play. And then in planning it, you're now planning your outputs of your human capital, demands based on probably the second leg, which is now what you call your social infrastructure, and of course, your critical infrastructure. The major problem we've had as a country is not the failure of the present leadership, but I think is the failure of the country not to understand the difference or the disconnect that was occasioned when we transmuted from being a colony of the British people to being an independent country. And in trying to put a definition to independence, we didn't actually look at independence in its totality. We got political independence, or so we thought. But we didn't also now look at the infrastructure of governance that were bequeathed on us, that was existing when we were still a colonized territory. And what was it? Most of the infrastructure that were bequeathed to us by the colonial masters were infrastructure that supported, what people call trade, what people call the movement of, our resources in its rawest form. And because we were comfortable, we now ended up becoming a country that now became based on our rental receipts. Okay, we didn't now develop an education system. Why I'm going back into the past is because a lot of people seem to say, oh, well, Nigeria is a failed state. Nigeria has never, well, yes, you could call it people try to make an inference by calling it a nation state. I don't think we've ever been a country. We've just been, a trade territory. And we've never understood, the importance of now defining education vis-a-vis developing, the kind of structures that can be able to support inclusive growth vis-a-vis our human capital development. And that is why in developing administrators or people getting PhDs, you find out that by the end of the day, you finish all it is you have done. There is no space in our geopolitics, in our governance structure that actually now cannot be able to capture you without your being introduced, okay, into that probably as somebody's protege, if you may. Now, why am I dancing around this? It's important because COVID-19, a lot of people have called it a scourge. A lot of people have called it a fraud. A lot of people have called it, God's judgment on man. But for me, I'm going to take it from a more simple definition, that there is this virus, no matter the medical people have not been able to tell us what it is, have not been able to isolate it. All they're telling us is one day you hear a story that is respiratory, the next day somebody tells you it's all about blood clotting, the other person tells you there are now about 4 or 5 different strains of it, the other one tells you is, and so for me, what is important, what is to be taken from COVID-19 is that it is a disease or a scourge that attacks you when your immune systems are at its lowest. That's my understanding of it. And that is why they say to you that most people that now fall, to the attacks are those who have underlying, medical challenges. And of course, those of us who are over 50 and heading to 60 and above, where our immune systems are much more reduced. And when we're talking about immunity, we're basically talking about, to what extent your body is fit enough. And what makes your body fit are 2 things. One, DNAs come to play. I'm not a medical doctor, but I believe that what you eat or what you don't eat has a lot to do with the building blocks that now make you, strong enough to be able to stave off whatever viruses or bacteria that attack your system. Somebody had mentioned, the failure of our health system in Nigeria. And that person had intoned, I think Georgina, it was you that was talking about herbal remedies or herbal drugs. Please note that the herbal remedies are actually the pathway in the new, medication. Everybody is going the way of herbal remedies. But I think where we've gotten it differently is that whereas other people are going and are calling it now nutritional support, we are still loading it up without it now being, first and foremost, going through the usual trials or whatever it is they call it in the medical balance. But trust me, most people who have beat this scourge, who have come out to say we beat this scourge, beat it using these herbal remedies. That is the truth. That's a fact. And it's out there for people, it's being published severally. For me, I think what we should be looking at for us as a country is not to begin to blame those we helped to get into power. It is to blame those of us who should know, who have taken a position of criticism, instead of now hopping into this fray to make certain, because right now, there is no other way you can take over governance of Nigeria without going through politics, except you want to take it by the nozzle of the gun. And then how many of us are involved in this political process? A lot of us who are academics, a lot of us who are social commentators, we say to you, it is the dirtiest thing, I don't want to have anything to do with it. But remember that it is politics that determines who your president is. It's a political process. So if we don't engage in this political process, everything we are going to be doing will be singing to the choir. But I'm not going to go into all that. I'm going to focus basically on what I think as a country we can be able to do to turn this COVID challenge into a major advantage. One thing is certain, a lot of our funds might not be able to go out anymore, because the chances that even if you take out the funds, you might not be able to go there yourselves. So there is now a new consciousness of people wanting to stay home and then fight it through. Now, what do I mean by this? If we as a country develop some kind of mobilization programs that begins to point people in the right directions. I read the economic stimulus plan, and I made my own comments privately to those that think that Otoh did. And I'm like, your assumptions are too ambitious. Okay, the assumptions you use in developing your economic stimulus plan are too ambitious. When you're saying that if you leave the economy the way it is, you are going to be entering into minus 4%, economic and negative growth. Whereas at the point in time, we hadn't even gotten into, the COVID. Every statistics that are being churned out were statistics that were being churned out using secondary, generation sources. We have been, in fact, we do not even qualify people listening to me to enter into recession, because recession is driven by your capacity to be productive. So when people talk about Nigeria entering into a recession, I say to them, you don't get it clearly. So, but let me tell you what I think this is all about. And let me tell you what I think this can be able to do. First and foremost, I want to use the story of a Cross River State. Okay, I hate him or like him. The man there has done one or two things that should be applauded. First and foremost, he started from developing his marks. He's now doing PPE. The same thing, ditto for Abia State. To what extent they are doing it, well, I do not know. To what standards they are doing it, I do not know. To what it is they want to get out of it, I do not know. But what is important is there's an attempt to at least get us at the local level to begin to find our own homegrown solutions. The army, remember, had also brought out one or two things. I think some testing kits, I think some ventilators even. And I want to say this because I know NIPRID, which is a research development agency under the Ministry of Health, had actually also come out one or two protocols that they believe can be able to support the body to build that, to build the amount of resistance issue, be able to step off, be able to help the nutritional support system to be able to grow. So for me, I think that when we look at Nigeria in its totality, everybody will see Nigeria as a failed state. But I do not think it is the right way to think, even if we're a failed state, because I know that the moment we get our backs, against the wall, you only have one option: either enter into that wall or begin to push back. So for me, I think it is time for our people, for our professionals, for our economists, for our medical persons, to come out, not to begin to critique, because I hear people talk about government should do this, government should do that. You cannot be calling on a government that is failed to do anything for you. I think it's for us to begin to have more of these town halls that we're holding now, and then come out with, not just with talk, but be able to now do a program of work in our own little ways, begin to now do these little things that can begin to change things. For me, I'll be able to share a little experience of what it is we are trying to do at our own level. We have decided that Nigeria has, from our little investigations, over 2,700 research outputs that are in papers and wardrobes and corridors. And what do? We said to government, listen, you people have acquired a lot of these technologies. You have not put it, and I'm not even talking about the ones that have been developed within the university systems. So we got across to the Ministry of Science and Technology to say, why don't you people now deploy these technologies into your communities and begin to see how you can be able to support the Nigerian communities? Because it's all about, well-being. It's all about access to, what you might be able to call the minimums for you to live as a human being. The moment you empower somebody, to be, everybody wants to live, or nobody wants to die. Everybody wants a good life for their children. But the major problem we have is that a lot of Nigerians, over 90% of Nigerians who live under $1 a day, are not able to even meet their immediate nutritional requirements to live. Talk less about talking about things like health and housing and all that. So if you improve the economy or the earnings of Nigerians, you are naturally going to be improving or increasing. They are going to be now looking for new demands to be able to better their lives. This is how it works. So for me, this is not a death knell. It's not a death sentence. I don't think it's going to be the end of the country. If we, who should be able to support, this movement, it's only in Nigeria that you see the kind of approach we have, to the COVID characterization. Somebody was talking about Nigerians not believing that this scourge is here. And for me, I hate to say this, publicly. I'm beginning to become one of those Nigerians because I've asked questions people are not giving me answers to. Now, what is my question? Every day you wake up and you announce 600 people, 700 people. Now, who collects these samples? How are they collected? Do they present themselves in the hospital, or are you going into the local areas to be able to do, some kind of random sampling? How do you pick these samples? How long do they stay? This your PCR thing. You're saying is, have you been able to reduce it to an 8-hour or a 4-hour, a 1 hour, a 30 minutes thing? Because against the rapid, test kits that they rejected and, preferred the more 24-hour, 8-hour culturing thing, how come we are not having these crazy numbers? I do believe that there is COVID-19, but I think that the approach of even the NCDC is a little bit arrogant. Okay, but we are not also going to, cross our hands and then sit on an armchair and say they're arrogant. I think we should be able to put that to their faces, and demand some kind of citizens, information to say, this is the way to go. So for me, there are 3 trenches to it. Trench number 1 is that the advocacy for us to be able to get Nigeria right has to be a development that now ties human capital development as a policy to social infrastructure development as a policy, to fiscal infrastructure development as a policy, to national development as a program. The moment we're able to tie these things, and trust me, these people don't know it. I am telling you because I know. You might think that becoming a PAMSEC, I had a small conversation with some people in government, and I said to them, you're an assistant director now. How many capacity training workshops, how many programs did you attend from the time you became a principal officer to now you are an assistant director? And the man looked at me and said to me, Doctor, can I be very, very frank with you? I don't think it's up to 1 or 2. And as far as I'm concerned, they were talking nonsense. So we also do not, ASCON is dead. Some of our parents who were in the civil service, my father, went to ASCON when ASCON was in Badagry, and it was a place of pride for people to go to. That institution today is dead. All our capacity in development institutions in this country, not one is functioning. So I think the major thing, we shouldn't be blaming the people in government who probably got in there as Alibaba and the 40 tips. All of us know how this administration emerged. We'll be fooling ourselves to think that any good would have come out of it. I hate to say this publicly, but it's important you look at somebody's pedigree and background before you begin to make demands on the person. Somebody who's not been able to help himself, somebody who's not been able to run a business, cannot be able to teach you how to run a business. You can't give what you do not have, and you can't build, something on nothing. So for us to be able to be making expectations of a government, and this is a country where the procurement process is all about loyalty and not about competence. So I think if we are going to be getting any benefit from this scourge that has come onto us, I think for those of us who are in, if you may call them elitists, you may call them educated, you may call them social class, you may call them whatever it is you call them, we need to begin to hold hands. We need to begin to probably, slow down on this blame game and then probably take the toga of pity to say, these guys who are blaming, do they know any better? Now, if they don't know any better, how best are we able to now help them to probably now understand that it is not all about blowing siren that makes you a governor, or having SSS or DSS, chasing people away from your car that makes you a public officer, but that it is your capacity and ability to be able to think out of the box, that actually now makes you, have that information that can be able to drive your people out of where it is we're going to. Somebody has said that COVID-19 is going to be here for the next 1 year. It is here to stay. It's not going anywhere. It's like Apollo. It's like every other virus that is either medically modified or lab originated or natural. They don't go away. And of course, viruses are not cured. Anybody who's talking about a cure, might not understand how the process runs. The best that might happen here is that you might be able to have, some kind of immunization that will be able to stop. But again, with the way the strains are, the variants are now transmitted, I am not even thinking. But by the time you finish finding, one thing that can be able to stop it, another variant might have been able to come. So I do not think that cure is an option. So I think that for me, to conclude this, where I've danced all over the place, the critical factor that we must look at is being able to empower our people to scale out of under the breadline, where we have more than 100 Nigerians right now. That's very, very key. And in doing that, for us to be able to do that, we must be able to create new economic streams that should be able to support every Nigerian, and then create what we call our national minimums. Right now, when we're talking about 15 or 18,000 as minimum wage, a lot of us kept quiet, and government has gotten away with blue model. There are people in Nigeria who are earning 15,000, 10,000, and then we're calling them, those are not human beings, as far as I'm concerned, because they are living under, subhuman conditions. There's no way 15,000 naira can be able to take care of any human being, and let's talk about somebody who probably has kids and then has other needs. So for me, it is all about us building the advocacy to be able to guide our leaders, so-called, to the path of understanding that the major problem we have as a country is the governance structure that was bequeathed to us, and that we need to be able to review it, especially, and this is my last note, when we're talking about the exclusive and the concurrent list. I think that is the devil in the room. The moment we're able to also now look at the subnational entities being able to live within, their limits, and be able to now develop, according to their needs, and then use whatever it is that's available to them to begin to now aggregate into a national whole, then we can be able to be building a good country, and one that is sustainable and functional. I thank you all for listening to me and giving me this opportunity. Thank you.
Really appreciate your submission today, Dr. Okengwu. Really appreciate you. One of the things I took out from your presentation is the issue of ensuring that we develop homegrown solutions to the pandemic. Homegrown solutions, very, very key. And then creating economic streams for people so that people are empowered, people are sustained, they can sustain themselves, as well as building advocacy to guide our leaders to understand that they need to wake up to their responsibilities and do what is right. Build our infrastructure, build our health system, as well as empower the people. Thank you so much, Dr. Okengwu, for your submission this evening. We have a couple of people who have sent in comments. There's a question we have, so I would love to start off with the question I have. Someone has written. Remember, you have to unmute your mic or indicate if you have one or two questions to ask the guest speakers today. But I will read out the comments in the chat box. Now, this question is being addressed to Dr. Daniel Otoh from AK Tobechi. He says, why are men dying more than women? I'm sure he's referring to those who are, who have died of COVID-19 related symptoms, and he's asking why we have more men dying more than the women population, or the women who have been infected. Dr. Daniel, you will take that question, but let me first of all read out the comments that we have in the chat box. The first person that sent in a comment is from, just in a moment, from Aloy. It says, it is a sad commentary listening to the speaker rail out the gloomy statistics. Is this country not a failed state? We also have from Emmanuel of the two. Considering our weak health systems and poor investment in socio-economic infrastructure, investments need to be channeled to addressing basic needs, investing in water and sanitation, infrastructure for rural poor and urban slums is therefore key. Thank you, Emmanuel. We also have from Avua Joseph Oteri. Why did the northern states, such as Kano, stop releasing positives? Is it now true to say that they shouted for more money after which they stopped testing? I do not believe there are no cases in Kano. from Victor Philly. I had an experience from an IDP camp today. The Ministry of the Ministry, or the Minister rather, of Humanitarian Affairs came to the camp today only for the chairman to sign a letter that they showed presence. Meanwhile, the ministry did not give them a grain of rice. They were chased out of the camp. Wow. Odinkalu Williams says, how do we prevent community spread in a situation where citizens do not believe that the virus exists? That is from Mr. Odinkalu Williams. Chris Agocha says, it is actually a good thing that the affluent and politicians cannot go abroad for medical treatment now. And I hope this will make them consider improving the deplorable healthcare system in Nigeria. Then still Odinkalu Williams, up till now, how many street mad persons have been diagnosed of this virus? How do you convince an illiterate that has never seen an impact of good governance in the country, and suddenly you wake up and tell them to start washing their hands? He's saying there's no running water provided. You tell them to use hand sanitizers when they cannot afford to. They are struggling to survive daily. Where is the government's duty of care? We are taxpayers. Where is that tax money going to? That's a question from Williams. Okay, we also have someone who is saying, what I am hearing is limited to criticism of national structures, questions on whether we have good governance or not, but nothing regarding developmental potential opened up by the pandemic. Our problem started a long time ago, and it is no use just criticizing, but we need to propose a way forward. All right, and that is from Olushola Ogunsheye. Let's see who else we have a comment. Let me take this from Mentus Ugu. No leader knows it all, and that's why there are provisions for advisors. What happens when you don't know as a leader, but instead of choosing professionals as advisors, you use the position as political settlement? How does the rest of the citizenry help such leadership, apart from blaming them openly and pointing out their flaws? Dr. Jeba, right, says this pandemic actually exposed that our healthcare system should be declared as a state of emergency. Cyril Uchenna, has it been scientifically proven that those with underlying health conditions and older persons are more vulnerable to COVID-19? I'm sure that is very clear from the subject I've been hearing and from reports from the WHO. Okay, more comments coming in. I think I should take a
Good evening, Madam Georgina. Good evening, Madam Georgina.
Hi, good evening.
My name is Victor Philip. Please, can I share the experience I had at the IDP camp today? Please, can you permit me?
Okay, you just make it as brief as possible.
Very brief. We were at the IDP camp today to share hand sanitizers and masks to the IDP camps. Like I said earlier on, we got there, and fortunately, just like 5 minutes before we got there, the Ministry of Humanitarian Resources came to the IDP camp, and the chairman of the IDP camp told us that all through the COVID shutdown, nobody from the ministry, from the government came to see them. Only for them to bring a letter today that they should please sign the letter that they got palliative. And he said to them, I will not sign this letter. And please, I don't want to tell my people that you people are from the Ministry of Humanitarian Resources, because they didn't even get a grain of rice. A grain of rice, all through the sharing of the COVID palliative. That if he tells his people that the Ministry of Humanitarian Resources is around, they came with their Hilux van, 3 of them, that they will burn that car, and it's not sure they will leave that IDP camp in Kuchigoro alive. They ran away. They had to hurriedly enter their car and run away. Why am I saying this? Going back to what Prof. Chidi said, we have a government that said they shared so much, 30.5 billion was shared as palliative for COVID. An IDP camp that is in Abuja center, in Abuja center, just by Gaines Village, they did not even get a grain of rice. It is to show the falsehood in the government of the day. That's why I said I want to share this personal experience I had today. It is a personal, a true life information. Anybody can go and investigate. The IDP camp in Kujigoro by Gaines Village. Ministry of Humanitarian Resources came today to tell them, sign that you guys got palliative. Meanwhile, they did not get a grain of rice. Thank you.
Thank you very much, Victor Philly, for sharing that experience with us. These are the issues that we're talking about, corruption in government, and we have a long way to go. Seriously, we do have a long way to go. But I would love for Dr. Daniel Otoh, if you can hear me, please do address the question from Tobechi. He's asking why we have more men dying instead of women, or more men than women who are dying of COVID-19. And as well as another question from someone who wants to confirm. He's saying, he's asking, has it been scientifically proven that those with underlying health conditions and older persons are more vulnerable to COVID-19? That's from Cyril Uchenna. Dr. Daniel, please go ahead and let us understand, respond to these questions. Dr. Daniel, if you can hear me. Dr. Daniel, please, could you respond? Or if he's not responding, probably we should move ahead.
Okay.
And then when he can he hear? Okay. Dr. Daniel, are you here? Okay, he's here. Please just unmute yourself and respond to the question. If you didn't get it, I can read it out again for you. Hello? All right, we'll have to move ahead. Okay, so let's just get to hear some more comments. There's a question.
Madam.
Okay.
Sorry, Madam. Can I just, my name is Chidi. Can I just respond to just one question that's been posed, or one comment that I have seen, because it's my Nigerian bugbear, really. I don't know who it is that says, there's a question, there's a comment about advisors and no leader knows it all, which is related to this point by Olushola Ogunsheye. What I'm hearing have been limited criticisms of national structures, questions on whether we have good governance or not, but nothing regarding development potentials opened up by the pandemic. Our problem started a long time ago, and it's not used just criticizing, but proposing ways forward. This is my problem with Nigeria. People talk about proposing ways forward. Sorry. How do you tell people stop stealing money meant for other people? How do you tell people what ways forward? You see, in other societies, we are dealing with transcendental ideas. You know, we vote money for research, and we're talking about how we want to protect research products, how we are going to bring the research to the market, how we are going to ensure production, and how we are going to ensure availability. And so you have a value chain. In Nigeria, there is nothing to talk about in terms of proposals forward. Because what am I going to do? Tell Malami to stop stealing? Or tell the people that Victor Philly has just told you about, please don't go and create fraudulent documents? My own limited experience in public service is that there is nothing new we are talking about. Everything is in official literature. Everything you need to turn Nigeria. So when I hear people telling me make positive proposals, I'm disappointed in them. There is no positive proposal you will make in Nigeria because there is nothing that you will not find in the vaults of the SGF. The SGF is the memory of government in Nigeria, and the SSG is the memory of government at the state level. There is absolutely nothing. I have worked, I mean, I can give you so many examples, but let me give you one. Law enforcement. Police Inspector General tells my colleagues and I, go and get me statistics on this thing. And we go and get the statistics, and the statistics are really terrible. But those are the statistics. Those are the scientific facts. And we lay them on his table. And he says, but you know what? You know, we cannot release this to anybody now. We cannot make this public, and we cannot publish it. So it dies. And all of planning based on that is what? Killed. A Chief Justice of Nigeria tells us, I need to monitor courts. I need to know how judges are performing. We bring methodology, we agree on methodology, we deploy, we go in, everything done. And he agrees on the judges agree to be monitored. We bring the report, the reports are terrible on the judges. Oh no, but you know what? We cannot make this public because people will lose faith in the system. So what are you going to do? Where exactly is it that we don't know what is happening? Oh, Magu is appointed and nominated and does not clear Senate. And we say, don't appoint him since he has not cleared Senate. And what happens? APC thugs say no, after all. And so a man who cannot clear Senate twice is made acting EFCC chairperson. And you don't know that in doing that, you have created an incentive for corruption. And he stays on the job longer than a person who would have been cleared. And you're telling me to make positive proposals. What kind of nonsense is that? I'm sorry. There is no big deal about what the problems in Nigeria are, but we will not admit them because when the person who is benefiting is from our part of the country or goes to our church or goes to our mosque or is our in-law, we will keep quiet. So can we just admit there is no rocket science about Nigeria's development problems? We are not looking to send people to Mars or to Jupiter. We are not looking to invent, look at it. Our universities, how many virology departments do we have in Nigeria? Nobody is talking about deploying any virologists. I here sent the first list to the president as we speak on this particular issue, saying, if you are going, this thing is coming. I did it as a memo to the presidency. This thing is on its way into Nigeria. And if you're going to manage it, can you please appoint a scientific advisor to lead it, who has this level of qualification and this range of networks? And I sent a list of Nigerians, all of them who are professors in virology in different parts of the world. What happened? We set up a presidential committee. Who did we appoint? APC politicians. What do you expect them to do? And we want positive proposals. It will not happen because we are not being honest. When you're telling me positive proposals, I think you're running away from honest discussion. The honest discussion is the country is not ready for honest, positive proposals. All the proposals exist. Implement them, but you will not because that is not going to work. Now, Mr. Ogusha is saying we have potentials to set up industries to sew scrubs. Why do you want what industry to sew scrub? That is positive proposal. I thought you were talking rocket science. So can we get serious? Industry to sew scrubs. My tailor in Aba is sewing everything. You're talking of industry. But you know what? Aba has been destroyed. So the tailors are struggling to get to the market. I thought you were a serious person, Mr. Ogusha. Is this your idea of positive proposal? I'm disappointed. I'm sorry, I've ended. Thank you.
Thank you very much, Professor Odinkalu. Yes, we have other questions. I hope the issue has been addressed. We have so many issues, so many contributions in the chat comments. Some persons have talked about the issue of the way forward. For instance, development of PPEs by Cross River State government. Another is the emergence of telemedicine. These are developmental potentials. Not everything is about PEMSEC and judges and governors. And he's saying, he's saying that he still believes that Nigeria has developmental potentials. And Kabul is saying, from info reaching the news, Kano is doing community testing from areas where there are no recorded cases of COVID-19. So the labs have thousands of samples to be tested. This has affected testing from states that are using the Abuja lab. Okay, so we also have this question that Dr. Daniel is yet to respond to. This is the time for you to respond, sir. If you're there, please do not, please respond to the questions so that we can move ahead. Dr. Daniel, you have some health questions there. Please unmute yourself and respond to the questions so that we can quickly round up. We have 30 more minutes to go on this program. Dr. Daniel Otoh. If you have questions, please go ahead. Either raise your hand or you type in the chat box so that we can read it out and address it to whomever you are asking. Some Olushola says Turkey is making loads of money from scrubs and other forms of PPEs, but I will not. Okay, let's it's okay. So it's a discourse. It's not an argument. It's a discourse. Let's keep it that way. All right. Thank you so much. So many questions. Dr. Daniel, are you ready to respond?
Yes.
Okay, please go ahead. You have two questions. Someone is asking. No, you have three questions. The first question: why are men dying more than women? The next question: if someone survives from COVID, does it mean the person is immune to the virus? Can he get reinfected? And then the third question is it scientifically proven that the elderly and those with underlying health conditions are vulnerable to getting infected with COVID-19? Please go ahead. Dr. Daniel, please go ahead. Hello?
Dr. Daniel, you're muted. You can unmute yourself.
Okay.
Now.
Hello, are you hearing me now?
You've unmuted yourself. Yes, we can hear you. Please go ahead.
Okay, so the first question, why are men dying more than the women? As a matter of fact, most of the case fatalities that we have, majorly in Nigeria, we're having over 700 and especially 35,000 confirmed cases. Most people that are affected are between the ages of 31 and 40. That is the statistics. And then the case fatalities we have, the number of deaths that we have, over 700 now, are majorly those that have comorbidities. As a matter of fact, I am still working with NCDC and also taking some of those statistics. And we know that the comorbidities or the underlying diseases that are very, very key, especially that make people to die very quickly, are still the diabetes, which is number one. And then we have issues of respiratory disease like bronchial asthma and uncontrolled hypertension, and then one or two areas of immunosuppression. So majority of those that are dead, the number of deaths we have are majorly those that have underlying diseases, which I have mentioned. And then most of them are also elderly because from the ages of 60 to about 70. And because their immune system are actually down, and so the COVID-19 will actually very much have effect and making them to die fast. And so men are actually, most men that we have are the ones that have these comorbidities. Most men are diabetic, especially uncontrolled. We have few women who are diabetic, but most of them they are controlled. And it is also the men that moves out, especially in this COVID era. Most men do not actually stay in the house, maybe in the bid to look for money and other things to bring for the house and cater for the house. They go out, and in the process, it's just like they said, the devil walketh around looking for whom to devour. COVID-19 actually moves around looking for diabetes and all these comorbidities to devour. So as men moves out in search of jobs and then money to bring back to the families, in that process, they got catch up with the infection. And I think that is one of the major reasons why men are dying more than the women. Men take more risks, men go out the more, men have more of the comorbidities, men are more hypertensive and diabetic. So those issues are there. So that's number one. Then for the issue of the infection, most people that were now infected and then got discharged, as a matter of fact, the studies have actually shown that if you are discharged, there is no long life immunity now that you can say you cannot be prone to another infection. And that is why we have problem, especially the problem we're having with immunization and vaccination. Because if we're talking about vaccination, it would have been faster if people that have already had the disease will now develop immunity, which we can then use to develop vaccines. So one of the issues we're having about COVID-19 is immunity, to develop immunity after being infected. And so anybody that hasn't been infected, there's still opportunity of him having to get reinfected again and again. And so if you're infected, you still need to be very much careful, especially in also keeping to safety measures and then infection prevention and control. Then the number 3 question now is, I can't remember now. What's the number 3 question?
I think you've actually responded to all of them. You said you responded to those who survived COVID-19.
Okay, yes, and then the elderly.
Yes, if you're immune to the virus. Yes.
Okay, so most of the elderly, because of their immune status that has gone down, they are quite, they can easily, they are prone and vulnerable to death. It can easily become severe in their condition, and then they die from it. And that is why we actually protect them, to make sure they actually sit down at home, especially if they don't have anything to do. Those are the response. Thank you very much.
Thank you very much, Dr. Daniel Otoh. Now, there's another question from Emmanuel Opetu. I think I will just direct this to Dr. Okengwu. He says, it therefore seems there is no solution since most have been exhausted. What are the adaptive leadership measures to ensure implementation? Can we also have small-scale interventions that can be private sector and community-driven? Emmanuel Opetu sent in that. If Dr. Okengwu is listening, if you can hear me, please go ahead and respond.
Thank you very much. I think for me, that's the way to go. And like I said, when we're talking about government, remember that we're talking about human beings. We're not talking about spirits. We're not talking about people that fell out of the skies. And again, like I said, the access to government, how you become a government official, it seems to, guides what it is you do in governance. So our recruitment process is actually the major problem. And that's why I keep saying that if we're going to be changing things, you're not going to be talking to the deaf. And what do I mean by not talking to the deaf? If you know that a man will not understand what it is you're talking about and does not have he does not even have the capacity to be able to, process it, why do you talk to him? It's important. There are 2 ways we can be able to take over Nigeria. And one way is, like I keep saying, where any government that comes with a policy focus, and whoever it is that helps that government to come into power decides the direction of the government. So in trying to say that our justice systems has gotten wrong, it's just not only the justice sector. It's in every other sector where people now begin to see public service, as access to public funds. So for me, on my own, I've just shared what it is I'm trying to do. I'm not a government officer. I haven't worked for government in the past 20 years. I went to the Ministry of Science and Technology to say to them, listen, from what it is I found out, you guys have over 2,700 research outputs that are lying in your files and your wardrobes and this? Can we be able to work together? So I'm not even taking it to the state governments. I'm not interested. Can we take it to these rural communities where you have this so-called production that is not existing, and let's begin to support them? This is me. Okay, but the moment you get that government buy-in, you can now begin to develop your implementation and your monitoring frameworks to be able to drive the process. That's how you can contribute to your own change. Okay, Chidi is a lawyer. When he was the chairman of Human Rights Commission, everybody in Nigeria saw the efforts he put. He made certain, he walked the street, he made certain that the right things were done. Okay, giving up does not solve the problem. What will solve the problem is to be able to create 1 million Chidis. There are a lot of people who believe in him. You started by the intro you gave to him was quite kind. So if he has 1 million of you from both men and women that is also able to keep knocking and keep insisting, you asked us to do this, we are going, this is where to get back our country. Not for us anymore. I'm close to 60, but I've got kids who are in their 20s. And they're going to have their own children and they're going to be Nigerians, at least for now, that we're still a country. So what's important, like I said, is let's not look at this cup from being half filled. Let us look at from being half empty. Let's look at it from being half filled. And then try to see what we can be able to do to ramp it up. You can't talk to the deaf, but you can take the deaf out. That's the point I'm trying to make. So in every way and any way, we can be able to come together to rescue this country, not for us now, but for the sake of our country and our children. I don't think any sacrifice, would be too much to make.
All right, thank you, Dr. Okengwu. Really appreciate your comment here. I understand Professor Chidi Odinkalu has left the building. He has something to do, so he has logged off. But I have a couple of comments here in the chat box. Some persons have sent in their comments. Uchenna. Sorry, let me start from Nonso Eguchulam. He says, concurring with Professor Odinkalu, there is no sincerity of purpose on the part of the government. Uchenna Noli says, leadership failure is so central to the present grim national situation. What is the practical approach to social political mobilization that will put the Nigerian people back in control of their political destiny? Joe Rary has a question for Professor Chidi Odinkalu. He's no longer, I think he has logged off. What he is saying, my question to Professor Chidi, do you believe there is any valid scientific medical justification for the continued lifting of lockdowns, restrictions over the globe by political leaders? Sorry, he is not here to respond to that. Victor Philly has talked about publishing the story, his experience at the IDP camp with News Agency of Nigerian Leadership newspapers tomorrow. So if we can lay our hands on that, please go ahead to read it up. Let's hear from, let's see who else has, I think one more question. Okay. All right. So let's see, any of the, Dr. Okengwu can actually go ahead to respond to the question that was directed at Professor Odinkalu, talking about leadership failure or believing if there is a valid scientific or medical justification for the continued lifting of lockdowns and restrictions all over the globe by political leaders. So Dr. Okengwu, please go ahead and respond to that.
Well, like I said, if you remember, I told you that this is not a disease. This is a scourge, and it's not going away in the next 20 years. It's here to stay. So if you think you're going to be locking down, remember that when we first started this lockdown, I was on national television talking about that you should stop talking about this index case, because the moment you have an index case, it becomes an index case and it begins to multiply. And then all of a sudden, the next report to hear is that there's now an index case that had no contact with any other index case. Okay? Now, this is how viruses travel. At this point in time, who had said to us, it could travel by air, it could be zoonotic, and then we've had, studies where animals could carry it. So if animals could carry it, what is the assurance that you can be able to get it from your pet or droppings of birds and all that? In fact, in the last 2 days, there has been a report of a mother to child transmission of the virus. So point I'm trying to make is you lock down, you lock up. There are two ways you can lock down. One can be a lockdown when your people, are social, when your social safety networks are operational. The other one will be a lock-in. And that was what happened in Nigeria. We didn't have a lockdown, we had a lock-in. And because we had a lock-in, everybody was attempting to break out. You saw it. They started attacking food trucks, they started attacking people, crime just, plummeted. And because you didn't have any program to be able to keep people indoors. It's not, it's yes, you might not be able to provide food, but people want freedom. That is also some kind of nutritional support, if you may. So the point is, if you lock up or lock down without a proper program for social safety, you'll be singing to the choir. What we need to do is to be able to develop protocols where we can be able to first and foremost take responsibility. And what is taking responsibility? See yourself as carrying that disease and then respect, the next person's right to life. And how do you do this? For crying out aloud, keep your distance from people, wear your face masks, okay? In whatever it is you do, and don't stay unnecessary, long where you're not supposed to be. If we're able to now, first and foremost, start living as if every one of us have a virus, we stop shaking, we stop hugging, we start doing stuff we're not supposed to be doing, we'll go to church and everybody is holding hands. I mean, this is how you spread it. No matter how much you think that the Holy Ghost can be able to cure you. Yes, he can. But the next person who's got it might not be as clean as you are, and the person starts spreading it. So point is, I do not think that the lockdown internationally, for those who had the disease and who could be able to, who had the mapping, they could lock down. But we don't have that kind of mapping protocols. We don't even have the infrastructure that can be able to support any lockdown. We don't have a habitation that can be able to support any lockdown. You have, compounds where you have 23 people sharing a toilet. If you lock all of them in and one of them have it, what have you done?
Dr.
So
Okengwu,
that's
please
my
don't
point,
go away
Georgina.
yet. Yes, please do not go
Yes.
away yet. We still have one more question for you from Uchenna Noli. He says, leadership failure is so central to the present grim national situation. What is the practical approach to social political mobilization that will put Nigerian people back in control? And he's also asking, is it safe to say the nation is now in a conundrum, looking at the influence of corrupt money and prevalent wrap value system on the political process? Is there any practical way forward on citizen mobilization?
Well, the leadership failure has started with Uchenna himself, because the question I asked him if we will talk is, Uchenna, did you vote? Uchenna, did you go out to mobilize? Uchenna, are you in any political program? Okay, it is very, very good for you to, blame people who are in government. To what extent have you also, as a citizen, been able to put your own feet down? You don't have to wait until you're in government to be able to put this together. Georgina, you have just coordinated this program. You are not a minister to do that. Okay, if Uchenna could also do something like that and begin at his own local level, even if it's 4 or 5, and begin to become an advocate. Now, when people talk about corruption, there are two things about corruption. One is that people get away with corruption, and two is that people, are now known to be corrupt and are named and shamed. And that's exactly what is happening in Nigeria now. It's no longer easy to be to get away with corruption, and then people are celebrating corruption. Because there are young people who are, there's this young man who's been doing the follow the money thing. A lot of people are waking up to, the realities of a country. So for me, it is work in progress. And the worst we can do is to step away from it. Everybody is part of this fight, okay? But what is most important is that if you think that the leadership systems have failed, go in there and pull your shirt, struggle for it, and then no matter how, you'll be shocked. Steve Biko, who turned the face of South African politics, was not a minister before he did it. Ditto for Nelson Mandela, ditto for most of the people who have become revolutionary, ditto for Adakaboro. So whoever it is that decides, okay, I'm not good with this, I'm going to abhor corruption, I'm not going to do X, Y, Z, I'm not going to condone it. Okay, I've gone into banks where you saw a big man wanting to jump the line, and a young man will say, no, sir. We can allow you to go, but it's not your right. There's a line here. That is how you can begin to now make certain that people do the proper things. So it's all about, are you doing what is right? It is one thing for you to come and blame other people and then go behind to go to and hero worship the same people. So truth of the matter is that there's no way we can have corrupt leaders if we don't have citizens that are urging them on. That is the pure idea of the story. So it's not only a question of leadership failure, Georgina, it's also a failure of a followership or citizens to be able to, also do what you call citizens' rights demand.
All right, thank you so much, Dr. Okengwu. We will have a few minutes more. I want us to round up this webinar by 5:30. So let me give Dr. Daniel Otoh maybe less than 5 minutes to respond to the last two questions that we have here. Dr. Daniel, can you hear me? Dr.
I'm
Daniel,
hearing you.
Thank you so much. Okay, so two questions quickly so that we can round off. Why are mad people not affected by COVID-19 and why are they not tested? Number one. Number two, what are the major socioeconomic positives of COVID-19? I don't know if you can respond to this particular question, but just respond to the one you can. Why are mad people not being affected by COVID-19 and why are they not tested? Dr. Daniel, you can go ahead to respond. You can unmute yourself and respond.
Okay. What is the question again? You say why are
mad people?
Mad people.
Yes, on the street.
Okay. Why are they not? Okay. Okay.
Tested, and why are they not being tested?
Okay. The issue of madness that is talking about, just like we said, before you can confirm a person positive for COVID-19, you need to do a test. As a matter of fact, even presently, we normally say that everybody is a suspect until proven otherwise. That is to say, every one of us are potentially a COVID-19 patient until we are tested. So until you are tested, you don't know whether you are free or you are not free. Because even majority of the confirmed cases that we have are still asymptomatic. And that is why we are saying that we need to increase the level of our testing capacity so that we can now reach more people and then we'll actually know the status that we have or the number of the real confirmed cases that we have. So as for the mad people, even if they have any infection or they have fever or anything, you might not be able to know until they are tested. So we cannot just bring them in until, and as a matter of fact, when mad people are sick and all that, nobody attends to them and they eat all manner of things. They have their kind of immunity that nobody can understand. They eat all manner of things and they don't come down with typhoid. So those are the things that we need to consider. Before you can confirm that, then it means that you need to test them, get them tested so that you can know whether they have it or not. So since we cannot test them, we cannot actually say why this or that. So I think that answers that. The second one is which one?
Socioeconomic positives of COVID-19.
Socioeconomic politics, right?
Positives. Like what are the positives from, yes, for Nigeria, if there is any?
Okay. Okay. There was one question that you actually asked about, especially the politics and the corruption that is in the health sector. I got that first, and I think that is actually what is actually making people now affecting a lot of people. Because even the health workers who are not paid, people have to consult them differently to take them to treatment centers. You need to bribe your way through and all that. And I think that is another issue that is even coming up. And I feel that this is actually from the top, because even some of the health workers are not being paid. Some of those that are even collecting samples, they are still owing them. And just like a week or two ago that we're having crisis even in FCT, There are people that are collecting samples, they refuse to collect samples. So samples kept on piling up. Those that are supposed to go for tests, they could not go for tests. And for those that were available, they are asking for logistics or money for them to be able to go out and then collect samples. So those issues are issues that are so numerous, especially in the town, and that has to be settled from government now paying, especially the things that they are supposed, the people that are supposed to be paid. There are a lot of, they'll come out and say they have paid them, but in the reality, some of them are not being paid. And for health workers to expose themselves to this COVID-19 without being remunerated for that is actually a major issue that is even bringing so many health problems now. And then some people that want to even go for treatment centers have to bribe their way because some of the health workers that need to attend to them, they have not been paid, so they feel unconcerned. So many of those cases are available and we need to. So some of the socioeconomic effect that we're talking about, social determinants of health, like all the housing, food, and all the things that affect health. And I think those are the things you are also asking. So the way forward that we need to talk about is for us to be able to handle these issues and then form an integrated response to make sure that we handle these issues early.
All right. Thank you so much, Dr. Daniel Otoh. I really appreciate all those who sent in their comments and contributions, questions. The panelists, Professor Chidi Odinkalu, Dr. Daniel Otoh, and Dr. Emeka Okengwu. I think that's, I hope I didn't miss something. All right, so thank you. Really appreciate all your contributions, your submissions on this webinar. We would have to round up at this point because we've really exhausted the time that we have. Let's have the closing remarks. Let's have the closing remarks from Bat Ekelemo. He's the NAS second mate. Let's have the closing remarks from Bat Ekelemo. If you are there, please unmute yourself and give us the closing remarks before we round up on the program today.
Hi, Georgina, I'm here. First, let me thank you so much for a job well done for moderating these activities very well. Again, my gratitude and thanks to Professor Chidi Odinkalu. It's always been our events and giving us good direction on how to lead changes, making change in society. Many thanks to Daniel Otoh for his medical and public health knowledge, which he has shared with us, as well as Dr. Emeka Okengwu. Again, Georgina, thank you for a job well done. Obviously, today has shown that COVID-19 pandemic has exposed Nigeria without a doubt. The frailty of our system, the suboptimal medical healthcare, and poor management by governments. Without a doubt, we need to continue the conversation, and hopefully we can find a path to national development. Once again, my gratitude to everyone who participated in this contemporary discourse, as well as the NAS Medical Mission team, Dr. Charles, Victor, and everyone that has put this together. Thank you, ladies and gentlemen. Thanks again. You're muted, we can't hear you.
Okay, so thank you very much. I hope we all were satisfied with the comments, the submissions, the answers to questions, and let's all work together. In fact, we need to work together. We need homegrown solutions to these issues. We need to move away from the blame game, just like one of the panelists said, and see what we as individuals can contribute to help Nigeria go past this. We need to start thinking post-COVID. What are the plans? What are we doing to ensure that we, build ourselves, build our little corners, help one or two persons around you, to be empowered and self-reliant. And I'm sure when each of us do our different parts, it will grow into a big social, political, or social economic development that would eventually, help the growth of Nigeria as a country. Thank you for the opportunity to moderate this webinar. I've learned a lot as an individual, and I will start doing my part if I have not started. Anyway, I do my own part the little way I can. I appreciate you,
Georgina,
the National Association of CDOs and the medical. Yes, yes.
Right. Something that brought to my attention. The term that was used to describe certain persons because of the conversation. Mad
yes,
people.
mentally challenged people.
From the NAS medical mission perspective, we don't have mad people. What we have is people living with severe mental health conditions. We just want to clarify that people living with severe mental health conditions, and there are no mad people. We recognize no mad people. Thank you.
All right, thank you so much. So I think at this point we would have to conclude and say we all hope you have a very good evening, and let's push the conversation beyond here to our different corners, our different workplaces, among friends and all that. Thank you so much, and it's time to go. Have a wonderful evening, everyone.
Thank you.
Good moderator. Thank you.
Thank you.
Thank you.